should the Health and Social Act 2012 be repealed, and if so, which bits ought to be in reverse, such as NHS Foundation Trust or commissioning?
Hi, I'm Shron Sen from Contact Family, who support families with disabled children. We are hearing from our families that they're being attacked on all sides in terms of being labelled scroungers for actually to claim benefits and support, whilst having their benefits and support cut. What are you going to do to change the debate and change the dialogue along those vulnerable groups?
Okay, thank you. So social housing, NHS and labelling of vulnerable group staff.
Are we taking them all three or just one at a time?
Why don't you go for social housing?
The social housing should be put into society. Yes, I think it should be actually. We were talking about this issue before, and I think one of the big challenges that the Labour Party has to face, and we have to face it as a movement, is the fact that the resources that we have available to us to do everything we want to do, and we think the state should be doing, can start drastically reducing. And I think we're going to need to start prioritising in a lot of areas. We were talking before about the concept of universality benefits in other areas, and I think we're going to have some very difficult choices to make in those areas.
When you say difficult choices, what do you mean by that?
Well, I think we're going to have to start cutting things. And I think we're going to have to start cutting things that we don't want to cut.
He started already.
No, it's interesting. I mean,
Please specific. Cutting things we don't want to cut.
Well, I think at the moment, what we sort of describe as a difficult choice is we say we're going to have to take a difficult choice, and that means we're going to have to tax spankers. That's not a difficult choice. That's a very, very easy choice. The sort of difficult choices we're going to have to take are going to be things like, do we want to reduce the number of nurses, or do we reduce the number of police? I mean, that's the reality that we're going to face after the next election. Now, whether we say that before the next election, that's a separate argument, but that's the reality, because unfortunately what we're going to find is there is an alternative to austerity for the next 10, 15 or so years.
Well, he's evolved a bit from social housing to austerity, but on the question of council housing and about mixed communities, which is a really important part of the question, I mean, if we talk about the original aim of council housing, when Nye Bevan unleashed the council housing revolution after World War II, he said he wanted to create mixed communities where the doctor and the butcher live next door to each other. He said it was the loveliest feature of the English and the Welsh village. And of course, because of the failure to replace the stock that's been sold off from right to buy, increasingly governments have treated council housing as a social dumping ground, and that diversity has very much been eroded. But the point is, this is the absolute key point, we are wasting billions of pounds of money in this country, and the government are right about this, on housing benefit. £21 billion a year. That isn't going in the pockets of the tenants. That is lining the pockets of wealthy landlords charging extortionate rent because we did not get the council housing. We use that money to build council housing. We stimulate the economy, create jobs, bring down the social housing, 5 million strong social housing waiting list in this country, and we bring down welfare spending too.
Okay, but can you just say how you'd answer the point about what about people who make use of social housing that it'd be hard to justify? You know, wealthy people. How do you justify that?
But I think this is an attack on the principle of mixed communities. I mean, we see this at the moment. This idea of, Policy Exchange have just come up with this proposal to basically get rid of social housing, which is above the particular market rent of the area, in order to build social housing elsewhere in other areas, which will just speed up the process of ghettoisation, effectively, where you have entire communities which are reserved for the rich and others which are reserved for the poor. And I think having mixed communities, as we did build, and just to finish, in the late 70s, of the top 10% of the population, 20% lived in some form of social housing. And I think that's a good thing. That's building a mixed community where people of different backgrounds live next to each other.
Okay, and on health.
Yeah, on health. The health bill was an absolute disaster and a calamity and a catastrophe for a whole lot of reasons. A reorganisation of the very worst kind in the absolute wrong direction. And I look forward to hearing what Andy's plans are for repealing the bill. So he says he's going to repeal the bill, and that's great, because what you need to do, first of all, is to take away the to monitor, that oblige every hospital and every to compete and oblige every service to put out to tender, and any company anywhere in Europe that feels a service hasn't been put out to tender has a right to challenge for it under European law. And we have to repeal that to make sure that it no longer comes under competition law, and that it is up to the best provider, which in my view will nearly always be the NHS, they may not always be. And the other thing that's completely wrong, which I'm afraid was started by Labour, was the foundation trusts. Right, foundation trusts were given this competitive mandate, where their whole motivation is to get more and more people into hospital and treat them in hospitals, when the whole motivation needs to be turned around the other way, so that there is a motive to treat people in the community more than the other way around.
Okay.
And I look forward to hearing Andy next.
I feel you've been slightly set up here, but I know you're more than capable.
Well, yes, we'll repeal the bill. And let me just give a specific one reason why. From tomorrow, the cap on the money hospitals can earn from the treatment of private patients will be raised to 49% from tomorrow, the 1st of October. So just think about that for a second. That will completely change the character of our hospitals if they can devote half their beds to the treatment of private patients. They will become, I think, different organisations completely. But it's not just that, obviously, there are a whole range of measures in the bill that are fundamentally unacceptable to this party that created the National Health Service, and actually that ran for all those years as a collaborative system. And a couple of arguments I would say to those who say, well, you know, didn't you do some of this? Well, the answer I would say about isn't, you know, what about the future isn't the way to get more efficiency. Number one, if you look around the world, all the market-based healthcare systems cost far more than the National Health Service. The National Health Service has proven to be the most efficient way of delivering healthcare to a whole population. And that answers Dan's point. The second point is this: markets in the end deliver fragmentation. The future demands integration. As our care needs get more complex, as we all live longer, you've got to have an integrated approach to care. You know, where you've not got a myriad of organisations providing care, but as truly integrated services. So I'll say more about this in my speech. But yes, we'll repeal the bill. Let me just finish by this point where people say, but there'll be no top-down reorganisation. It's simple. I will ask the organisations we inherit to work differently, to work back within a collaborative structure where we've completely rewritten again the legal basis of the NHS. And as Polly says, removing that Part 3, that competitive market. So that's what we will do. We will repeal the bill and we'll get the NHS back to an NHS that works based on collaboration, not competition.